Planning. Planning involves setting priorities, identifying patient-centered goals, and expected outcomes, in addition to determining individualized nursing interventions. It requires critical thinking through deliberate decision-making and problem-solving. Priority levels can change as client condition changes. We need to look at Maslow's hierarchy to help us prioritize. We start off getting our basic physiological needs taken care of first, which would include our safety, our oxygenation, and our circulation, to name a few. And FYI, pain is considered to be a psychosocial need, not a physiological need. So it does not take priority. Although, we do like to take care of our patient's pain, sometimes there's things that need to come first. Different classifications of prioritization would be high. If it's left untreated, it would result in harm, which would also include, again, our safety, oxygenation, and circulation. Intermediate is non-emergent, non-life-threatening needs. And low is not always related to illness, but it can affect future well-being. A changing client status can adjust all of these effects on priorities. Goals are broad statements that describe a desired change. An expected outcome is defined as measurable criteria to evaluate goal achievement. Several expected outcomes may be necessary to be met prior to a goal being achieved. We have different types of goals. We have short-term goals, which are usually less than a week. We have long-term goals, which are several days, weeks, or even months. When the client or the client's family or both buy into the goal, the client is likely to be more successful and more compliant. There is a common set of outcomes that will allow nurses to study the effects of nursing interventions over time and across settings. How do we determine a goal? Well, first of all, we look at the nursing diagnosis. What do you see that you want to be fixed? That's your goal. For example, you may have alteration in bowel elimination, constipation. Well, obviously we're going to want the constipation fixed. So our goal is going to be, alteration in bowel elimination, constipation, as evidenced by inability to defecate times 3 days. One of our goals would be client will have a bowel movement on a daily basis without the use of laxatives. That would be a goal. And our time would be every day. So look at your nursing diagnosis and try and figure out what it is that you want to be fixed. The expected outcomes are going to be, how am I going to accomplish that client having a bowel movement every day without the use of laxatives? Well, I can offer fruit juices. I can set the client on the toilet 30 minutes after a meal. I can encourage fluids. I can encourage exercise. All of those things are going to be expected outcomes. You're going to do this by doing this. So guidelines for writing goals and expected outcomes have to be patient-centered. So they have to reflect the client's behavior and the response. It needs to be a singular goal or outcome. It should address only one behavior or response. It has to be observable. In other words, it can't be something that you feel. It has to be something that you can actually see. It has to be measurable. You have to put a time limit on it or some type of measurement. It has to have a time limit on it. These time frames will help the nurse and the client determine whether the intervention has been successful or not, or if the client is making reasonable progress. There have to be mutual factors. This will increase the client's motivation and cooperation, and they have to be realistic goals. You cannot put a goal of a client who has been bedfast to ambulate within 1 week, because it's probably not going to happen. Ambulating 150 feet without assistance in 1 week's time. That is an unrealistic goal for a client who has been bedfast. We need to build up to it. A more realistic goal would be client sitting up in the chair for 30 minutes, 4 times a day, for 2 days. Client then taking steps to the doorway with assistance, with assistance of 2 staff and a walker. You want realistic goals, and it's okay to build up to the ultimate goal in pieces. So types of interventions are divided into categories. We have nurse-initiated. These are ones that do not require an order. Physician-initiated do require an order from the physician or the healthcare professional. We have collaborative, which require combined knowledge, skill, and expertise of multiple healthcare individuals. And we need to make sure that the interventions are appropriate for that client prior to implementation. Each intervention in the nursing interventions classification has a variety of activities for nursing care. You're also going to learn about different interventions that can be done through nursing school, and you'll find that there's a variety of interventions that have rationales in your nursing care plan book. And you are allowed to use your nursing care plan book when you are building your nursing care plans. The nursing care plans that you do for nursing school have to have a rationale for the intervention. Rationales always must be cited. You have to tell us where you got that information from. And don't put like nursing care plan book. You need to put the nursing care plan book and put the appropriate name for the nursing care plan book, but make sure you put down what page you find it on. Now, internet sources are also viable, but you need to put the link. Your instructors do not check every intervention, but your instructors will go back and do some spot checking. And we need to be able to pick up the book or pick up the computer and go straight to the source of information that you were looking at so we can confirm that it's appropriate. With computerized documentation, a lot of care plans that you will see in facilities are now electronic. They're standardized nursing care plans, but they always have to be individualized to fit each client. There are interdisciplinary care plans out there that involve several different disciplines all at the same time. Might include nursing, medical, rehab, etc. You will be involved in doing change of shift reports. This is also known as a nursing handoff. Change of shift reports can be audio taped. They might be face-to-face. You may have walking rounds where you go from room to room to do your report. Nursing care plans can help organize information that is to be passed on to the oncoming shift. And again, we have concept mapping. This will allow the nurse to see the relationship between the diagnosis and the interventions, and how one intervention may work for more than one diagnosis. A consult may be done by a nurse, may be done by a healthcare provider, or interdisciplinary team members. Consultations occur when a problem is identified that requires additional therapies that have not been provided by the current care, or maybe the exact problem remains unclear. Direct consultation to the appropriate professional. And realize that consultations usually will require a physician's order because this is going to cost the client money.